Hi everybody, this is Dr. Premanand. I'm a facial maxillary and aesthetic surgeon, director of Anew Aesthetics. Today I'm here to demonstrate on this amazing technology called HBOT. The chamber, it looks a bit scary when you see from far, but it's very simple and very sophisticated and very customizable. And so let me just have a tour of this chamber so that you feel comfortable. Most of the people seeing this, they say that it's very claustrophobic, or they feel that they are put something into a oven or something. It's nothing like that. It's amazing thing. Once you get in, you will know how comfortable and how youthful and energetic you're gonna come out with. So coming to this chamber, this is from South America, Peru. We have imported this, and it's completely a FDA approved chamber. FDA approves this for the safety of the device and for the standards what they've used, especially the acrylic glass and the control systems and the control panel and the safety of the patients. And in case of emergency, how do we stop the device and how do we bring them, we call that as a decompression. How do we decompress them and all this. It's very, very sophisticated device and very safe, and this is the most celebrity preferred machines all over the world. And we have few do's and don'ts before getting into this chamber, so we will get a glimpse of that. And then coming to the chamber, Mr. Harish is there here with us, who helps us in with the assisting the patients getting in. So this is how I can open. So you have this is a pressurized chamber, so so it is very well locked, and this is how you open the chamber bed luggage. And you get this stretcher out. It's very, with just one finger it can come out. It has got a very good trolley system. And the patient comfortably goes in. And once the patient goes in, it becomes much more comfortable because the trolley becomes much more smoother. You can just see I'm just pushing it with one finger. So, and the patient goes in. This is the head end, and that would be the leg end. And once the patient is in, we close the chamber. So, because it has to withstand the good pressure, so it's completely sealed now. So once this is done, so coming to the mid portion of the chamber, and this is the most important and the valuable. The whole acrylic glass is what the machine cost us a few crores because of this glass. So this glass to when the submarine, this is the same acrylic glasses which are used in the submarine, because it needs to withstand that much of a pressure. When you go 30 meters depth, what pressure it has to withstand, the same thing is used here also. And this also helps the patient to view us, communicate with us, and even they can watch the program, the TV, and they can chill so that they don't get nervous about the thing. So this is the main control system of this HBOT chamber, and we need to draw a dedicated line. So we have a oxygen plant, and the dedicated line comes from the plant. You cannot have some cylinders, you cannot have this beauty parlor stuffs here. This is a completely a professional one. So the dedicated line is drawn from the plant, and it is connected to the the chamber at this point. And this is the treatment setting. So what happens is, once the patient is in and completely he's sealed inside, so you need to ventilate the air what is being inside. So we have a different ventilation rate. So we exhale that complete air out, and then we pressurize the chamber with the oxygen. So we set few parameters. So depending on the conditions, for wound care it is different, for anti-aging it is different, for wrinkle reduction it is different, for sagging is different. We have parameters which are we can set the parameter here. Once the chamber pressure is set here, then we see the treatment pressure. So the treatment pressure and the chamber pressure is both the guide plane for us to have a required specified this thing. So that once the treatment pressure is set, the chamber pressure has to reach to the same amount. Once this is done, and then this is the speed in what rate we want the chamber pressure to reach the treatment pressure. We can either, in a simple word, to say how fast you want him to dive in and dive out. So it's otherwise called as a decompression also. And this is the master control. In case of any emergencies, you just need to switch it off, and then you press the emergency button, and the oxygen is released in a fractions, so that the pressure comes down drastically and the patient is safely decompressed, and he can be brought him out within less than 5 to 6 minutes. And this is the safest this thing. And this is the oxygen, very important. What is the pressure we are achieving from the plant? Once this is optimal, then only the whole system starts working. And we have a timer, and it is completely air conditioned, and even you have a intercom system to talk with the client and to know how well they are doing. We ask them every 5 minutes, are you okay, are you okay, and are you doing good? And they do good, so the treatment keeps continuing. If they are not happy, if they want some break, or if they want to stop the treatment anytime, just off the master control, start decompressing and slowly take them out. So it's very well set, and it's very safety, and we have everything in our control, and we are here full-time monitoring the patient for the whole session to see the complete well-being and to have a happy experience. Thank you.